I remember how my dry eye practice evolved. Starting maybe 10, 15 years ago, we basically looked at patients in a very limited way. If they had signs, if we could see some sort of staining on the front of the eye, we treated those patients. We now know that signs and symptoms in dry eye don't match. Many times they're completely disparate. So we may be treating a patient's symptoms in a lot of cases today, where in years past we wouldn't have done that. So this evolution has led us to a point where if you don't ask a patient what's going on with their eyes, they're probably not going to tell you that they have dry eye. Unless you see it on the eye, there's not going to be any connection to that patient's dry eye symptoms. So asking the patient is absolutely critical. What I've used is the Ocular Surface Disease Index questionnaire. And that's a good way to link to the patient's symptoms, but you got to know that the patient has the symptoms in the first place before you're ever going to get them a questionnaire in their hands. So all of my staff, and myself included, will ask a patient if they have any symptoms related to dry eye. It's a standard part of our case history. Because most patients think that dry eye is part of getting older, and they don't think that there's many treatments out there. So it's up to us to educate them on that. It's up to us to ask.